Good day, viewers. Welcome to another biology presentation. So in this presentation, we are going to answer 10 multiple choice questions based on the methods of birth control, benefits of using contraceptives, and risk of using contraceptives. So this is your presenter, Mr. Mlenga. So let's look at our question 1. So here is our question 1. The question reads, which of the following is a hormonal method of birth control? Which of the following is a hormonal method of birth control? A. Condom. B. Diaphragm. C. Birth control pill. D. Spermicides. So we are looking at which of these is a hormonal method of birth control. So the hormonal birth control is birth control pill. This is the hormonal method of birth control. So birth control pills, they contain hormones such as estrogen and the progesterone hormone. These hormones, they prevent ovulation, okay? They also thicken the cervical mucus and they make thin the uterine lining, and they also have condoms, diaphragms, and spermicides. These are non-hormonal barrier or chemical methods. Okay, so we can now move on to our second question. So here is our question 2. Our question reads, which birth control method offers protection against most sexually transmitted infections, which are STIs? A. Intrauterine device, IUD. B. Contraceptive implant. C. Male condom. D. Vagina. So we are looking at the birth control method which offers protection against sexually transmitted infections. So that is the male condom. So we know that there is no any method which is 100% effective against all the sexually transmitted infections, okay, apart from the male and female condoms. So these two, they act as a physical barrier. Significantly, they reduce the risk of transmission for most commonly STIs that can include HIV. Okay, so now when you look at other methods of primary prevention such as pregnancy, and they also offer little support to no STI protection for other birth control methods. So this one is the best. Okay, so we now move on to question 3. So our question 3 reads, a significant benefit of using hormonal contraceptives like the birth control pill is A. Complete protection against STIs. B. Regulation of menstrual cycles and reduction of cramps. C. Permanent sterility. D. Increased fertility after discontinuation. So we are saying a significant benefit of using hormonal contraceptives like the birth control pill, okay, is that the best answer here is that there is regulation of menstrual cycles and reduction of of cramps. So our correct answer is a B. So here we know that hormonal contraceptives, they often lead to lighter, more regular periods, and they can significantly reduce menstrual pain, okay, for many users. Apart from that, they do not offer complete STI protection because they cause permanent sterility or increase fertility. That's why this one is our best answer. So we now move on to our question 4. So our question 4 reads, which of the following is a long-acting reversible contraceptive? A. Withdrawal method. B. Contraceptive patch. C. Hormonal intrauterine device, which is IUD. D. Female condom. So we are looking at which of these is a long-active reversible contraceptive. So the long-acting reversible contraceptive is what? The hormonal intrauterine device. It can be reversed, but it's the longest one, okay? So the correct answer here is C. So these are long-acting reversible contraceptives. They are highly effective birth control methods that can be used for several years. So for hormonal IUD, like we have Mirena or Kirina, and the contraceptive implants, okay, these they fall into this category. Now when you look at the withdrawal method and the female condoms, these are short-acting user dependent methods. Okay, and the contraceptive patch is also a short-acting hormonal method which is used weekly. Now we are looking for the long-acting. That's why this one is the best answer, which is option C. So we now move on to our question 5. So our question 5 reads, a potential risk associated with the use of some hormonal contraceptives is A. Weight loss, B. Decreased blood pressure, C. Increased risk of blood clots, D. Improved vision. So we are looking for the potential risk associated with the use of some hormonal contraceptives. So when you look at weight loss is not a potential risk, because if someone is taking in some hormonal contraceptives, they gain weight. So this one is not the answer. Also, decreased blood pressure is not the best answer. The best answer is increased risk of blood clots. So the correct answer here is C. It's a C. So here, when we look at, we know that some hormonal contraceptives, particularly those that contain estrogen hormone, they can slightly increase the risk of blood clots. Okay, meaning that they affect deeper veins through the process called thrombosis, particularly the pulmonary embolism or stroke. Now, other options they are not associated with risks like I've explained. Some hormonal contraceptives, they can lead to weight gain, like I've said. Others, they lead to increased blood pressure. Now, this one is saying decreased blood pressure. That's why it's not the correct answer. Okay, so we have answered our question 5. We now move on to our question 6. So our question 6 reads, which method of birth control involves surgically blocking the fallopian tubes in women? A. Vasectomy, D. Tubal ligation, C. Nexplanon, D. Depo-Provera. So we are looking at the birth control which involves surgical blocking of the fallopian tubes or the oviduct in women. So that birth control is the tubal ligation. So the correct answer is a B. So tubal ligation, which is often called tying the tubes. Okay, this is a permanent surgical sterilization method for women, which prevents the egg from reaching the uterus. Now, when you look at vasectomy is a male sterilization, okay, method. Now, when we look at this other one, which is the Nexplanon, this one is also an implant. And when you look at the Depo-Provera, this is also an injection. Okay, so the one which have a surgical birth control method which takes place in women where the fallopian tubes are going to be blocked is tubal ligation or tying of the tubes. So we have answered our question 6. We now move on to our question 7. So our question 7 reads, a benefit of using barrier methods of contraception such as condoms, diaphragms is dash. So we are looking for the benefit here. A, high effectiveness in preventing pregnancy with a single use. B, no need for user intervention before or during intercourse. C, protection against some STIs. C, regulation of menstrual periods. So what is the benefit of using barrier methods, contraception, such as condoms and diaphragms? What is the benefit? So the benefit here is that there will be protection against some sexually transmitted infections, because a male condom or a female condom, it will be able to prevent transmission of sexually transmitted infections. Same with the diaphragms once they are inserted inside the vagina. So our correct answer is C, protection against some STIs. Okay, so we now move on to our question 8. So our question 8 reads, which of the following is a common side effect experienced by some individuals using the Depo-Provera injection? So remember, I've talked about the Depo-Provera injection. So which of the following is the common side effect, okay, experienced by individuals who use the Depo-Provera injection? A, extremely heavy menstrual bleeding. B, permanent increase in bone density. C, irregular bleeding or absence of periods. D, significant decrease in appetite. So here people who are using the Depo-Provera injection, they normally experience irregularity, bleeding, or absence of periods. They may find that they are not experiencing the periods, or they're having irregularity, bleeding. So our correct answer is a C. Okay, so I hope it is clear. So this Depo-Provera, it is actually known to cause changes in the menstrual bleeding patterns, which can lead to irregular spotting, also prolonged bleeding. And for some main users, people use this injection. Eventually, they can experience a complete absence of periods, like I've explained. Also, it is closely associated with the potential bone density loss over time, which is irreversible. It's not an increase, like they have said, a permanent increase. No, it's not an increase, but it will result in a decrease. So our correct answer here is a C. So we have answered our question 8. Let us now move on to our question 9. So our question 9 reads, natural family planning methods rely on dash A, surgical intervention, B, hormonal regulation, C, tracking fertility signs like basal body temperature and cervical mucus, D, barrier devices. So when we look at the natural family planning, okay, methods, these they rely on what? They rely on tracking fertility signs like basal body temperature and cervical mucus. So what this means is that the natural family planning, also known as the fertility awareness-based methods, they involve tracking a woman's natural signs of fertility. For example, we track the body temperature changes. We also track the cervical mucus consistency, also the calendar tracking, okay, in order to identify the fertile and infertile phases of the menstrual cycle. So this is why you are able to see that here people will be looking at what is the calendar for this female. They want to track the menstrual cycle so that whenever they sleep with that female, she's not going to fall pregnant. Okay, so these will result now in not involving the surgery or the hormones or any barrier devices. It's a natural. So this is why option C is our correct answer. They need to track the fertility signs like the basal body temperatures and the cervical mucus. So we now move on to our question 10, and this is our last question. So our question 10 reads, what is one major benefit of using contraception beyond preventing unwanted pregnancies? So we know that contraception, their primary benefits is preventing unwanted pregnancies. Now, what is the other major benefit apart from this? A, it eliminates the need for regular healthy checkups. B, it can help in family planning and spacing of children. C, it guarantees a specific gender for offspring. D, it makes individuals immune to all diseases. So the major benefit of using contraception beyond preventing unwanted pregnancies, we understand that when we look at contraceptions, they allow people and couples to consciously decide when and if they can have children, and also to have some space bets upon the children, so that there is that child spacing. Now, here we can see that the correct major benefit of using this is it will help in family planning and spacing of children. This is our correct answer. So we've come to the end of our presentation. Thank you so much, everybody, for your patience. So if you want to join our online tuitions, you can please WhatsApp me on 0963 6766 15. Then I'll add you to a class for biology or mathematics for online tuitions. So thank you so much once again. This has been your presenter, Mr. Mlenga. Bye bye.